Hi, I'm Dr. James Machino. Let's talk about the treatment of menopause, or the treatment of menopausal symptoms, if you will. You know, menopause is that point in a woman's life where her monthly cycles come to an end, and she often will end up with hot flashes, night sweats, insomnia, racing heart rate, changes in how she feels. And, the symptoms can be treated, but I think it helps to first understand, what's happening behind the scenes that's causing it. So why does menopause occur in the first place? Well, at the end of a menstrual cycle, estrogen and progesterone levels drop very low. There's a gland in the brain called the hypothalamus that senses that, sends releasing factors to the pituitary gland, also inside the brain. The pituitary gland then sends through the bloodstream hormones down to the ovaries called FSH and LH, follicle stimulating hormone and luteinizing hormone. Tells the ovaries, okay, let's get some of these mature eggs that are in the ovaries to start maturing and developing. And that's what they do. And then around day 14, one of them has outpaced the rest and sort of jumps out into the fallopian tube. We call that ovulation. And while the egg is sort of maturing, it's secreting estrogen. While it's rolling down the fallopian tube after ovulation, it's secreting more estrogen. And the part that gets left behind after ovulation is called the corpus luteum. And that secretes progesterone, which is higher in the second half of the menstrual cycle. So now if that egg doesn't get fertilized at some point, then it runs out of steam and it sort of shrivels up and it stops secreting estrogen. And at the same time, the corpus luteum shrivels up inside the ovaries and it stops producing progesterone. So now estrogen and progesterone levels drop down again. The endometrium gets sloughed off during the menstrual flow period. And because those levels are really low now, estrogen and progesterone, the brain says, okay, let's do it again next month, and you start another cycle. So what happens at menopause? What happens at menopause is not that you don't have egg follicles in your ovaries anymore. Just these are the ones that have had 35 years to respond to those hormones. They're the least responsive ones. They're the least intelligent ones, maybe. So the brain says, I know you're in there, so let's get another cycle going, girls. And those hormones go down through the bloodstream and the ovaries. Now they're not responding. So the pituitary gland starts to bombard the ovaries with these hormones to try to get another cycle started. And it doesn't work. And this rise in these hormones from the pituitary gland is causing a lot of the symptoms that women get. And then there's a spillover effect where they start to secrete even adrenaline, which is a neurotransmitter. And the combination of this results in hot flashes, night sweats, insomnia. It can be personality changes, skin changes. You start to see a change in breast density on mammography, skin dryness, vaginal dryness. And with the drop in estrogen that stays low, there's an increased risk of osteoporosis as well, because estrogen helps to keep calcium in bone. And even a woman's libido can change. So what are the treatments? Well, the medical treatment originally was to give women estrogen and progesterone back, which sort of made sense, but they used dangerous forms of estrogen and progesterone. These were sort of synthetic forms or forms that came from the urine of pregnant horses, actually, conjugated equine estrogen. And it's just too powerful for a woman's body. It's kind of like putting fertilizer on her breast cells that made the cells divide too fast. When cells divide too fast, there's a greater risk of cancer. So breast cancer increased by 21%. And also it caused the blood to thicken up and form abnormal clots. So there was also an increased incidence of heart attack and stroke. So around the year 2002, certain studies showed that it was kind of dangerous to keep doing this. So only in select cases do doctors even recommend it anymore. What's new are bioidentical hormones. And honestly, in my view, they haven't been around long enough for us to know if those forms of estrogen are safe or not. I worry about estrogen causing cells to divide too fast and may increase risk of breast cancer or cause some vascular complications. I'm not comfortable yet with bioidentical hormones other than using natural progesterone, which I think is totally fine to do. And some doctors even recommend, anti-anxiety drugs and antidepressants to help women psychologically deal with menopause. I don't think that's the best answer. I think the best answer is to use natural things that are safe and non-toxic. So there are some natural herbal agents that have been proven to work that are safe, non-toxic, as well as some dietary approaches that I think you should know about. And the reason you should know about it is because most doctors never get enough nutrition training to see the scientific evidence to support it, so they tend to use drugs in one form or another. And so I would think what you ought to do is download my book called The Natural Management of Menopause. It has all the scientific references in it. The Natural Management of Menopause. It's an ebook. It's available right here. And you should read it through from cover to cover and really understand what you can do in a more natural, safe, and effective way. About 80% of women get total relief by using natural interventions, and that's the point I want to make. Now, machinohealth.com, you'll see all my other review papers and videos, footage from my live professional seminars, downloads, all kinds of resources I've created to help you lead a long, healthy, highly functional life. My review articles and all my teaching materials come complete with all the scientific references, all evidence-based stuff. You can see them there so you know you're only getting very scientifically accurate information on any topic that you're looking for. So you really should, in my opinion, make machinohealth.com an ongoing, reliable resource for health and wellness information for both you and your family members whenever you're looking for any advice or suggestions on what you can do in a more natural way. So thanks so much for watching. I really appreciate it.